Hello, everyone. I'm Dr. Diana Bitner. I am co-founder, chief medical officer of True Women's Health, and I'm very happy to be with you tonight to talk about a subject that sometimes is a little difficult to talk about. We wondered how many people would come on live because it can be a little intimidating to have your name on the list, but we sure hope people are comfortable. The more we talk about this, the more that we'll talk about this, right? So I love the picture of the three women on our lead for this conversation, of these three women comfortable laughing, and we know that the topic of female sexual health and intimacy and confidence is something that we all talk about, maybe at book clubs or at the salon, or with our friends when we get together. And I want to think about this like I'm talking to my friends, to my patients, to women who care, because this is a topic we really need to talk about. And so I always start these Let's Chat off with, why do I care about this? So our Let's Chat tonight is about feminine confidence. Again, just all different ways to say sexual health and intimacy. And this topic is so important to me because I see women suffer in silence. And, last night as I was thinking about this topic, I even made a list of, reasons that I see women suffering in silence. It's sometimes hard to remember all this on the fly, but so I'm going to look at my list. But I see women suffer because of poor self-image, either because of weight gain or because of just being uncomfortable with how we tend to call it the lady town at True, but how their anatomy will change, or how they're have dryness. I had a patient who today talked about feeling like she's dried up, like all these negative words. And I said, let's flip things around. Let's talk about how you want to be and how those are possible. So again, so many women suffer with this poor image of themselves, either physically, mentally, how they feel about themselves as they're being tired or, feeling older. So again, suffering from poor image can just really hurt our confidence. It's having memory of a prior bad experience. So I have patients who were in an unhealthy relationship, who sex just wasn't a comfortable thing to talk about. It was maybe memory of an abusive situation where a woman felt powerless or without ability to choose whether or not she had sex, or how she had sex, or how often she had sex, or what sexual practices happened in that relationship or that situation. Maybe there was a time where sex had to stop because of pain, and that is a memory that she's afraid of repeating. I don't want to have sex because what if we do and I have pain and we have to stop and my partner gets mad at me or disappointed, or in the middle of things and it's an issue? Or what if I have incontinence of stool or urine while we're having sex? No style points for that. That can make someone feel very afraid to have sex again. And again, women just don't have to suffer. Having been taught that sex is dirty or bad in all cultures and all religions, this sometimes can be a theme where sex is seen as dirty or bad, and it's not seen as a wonderful part of a loving relationship or being comfortable with one's own body in a way that is intimate and has pleasure. So this is a big hurdle to get over. I'll talk to some patients about, let's say, their sex drive, and they'll say, I've just never been sexual. It was a taboo subject. We weren't allowed to talk about it at home. I felt like my parents were very uncomfortable talking about it. So a lot of people have just had this ingrained perception that sex is, again, bad or dirty, and that can be a hard hurdle. A lot of women have a lack of knowledge about anatomy. And for those of you who have seen me in the office, or, we use the mirror and we talk about, let's look at the anatomy as we're doing the exam. It's not that I would insist that a woman look at her anatomy if she didn't want to, but yet it can be really an important part of lack of fear of what's going to happen, or the ability to have pleasure, to know where the anatomical areas are, especially if there's pain, to be able to localize where the pain is. Is it on the perineum, that area between the vagina and the rectum? Is it on the vulva? Is it on the labia minora? Is it near the clitoris? Where is everything down there? And it can be really important to pinpoint that. And so again, when we do an exam at True, We often use a mirror to explain things. And again, I really encourage people to know their anatomy, and often they just have never looked or never asked. There's a lot of women who suffer because of lack of knowledge. I'll ask all my patients, are you in the lucky 30? They're like, what does that mean? The lucky 30 is where we know that only 30% of women can have an orgasm with penetration. And so that means, for example, with penis in vagina, there's an orgasm, but only 30% of women can have that. So when people know that, then it's like, okay, if I don't have that, it doesn't mean I'm broken. It doesn't mean that there's anything wrong with me. One fact about arousal, it can take 30 minutes for women to get aroused. It takes men maybe 30 seconds. And so just by knowing that, you don't think something is wrong. And so you can time activities, to give yourself time to think sexy thoughts, or to use a lubricant, or again, to not think something is wrong. And so there's a lot of good information that is out there that we can guide you to really help you understand what is normal sexual function and how do I fit into that. It's being shy or afraid to ask for what you want. So a lot of women that I take care of are very afraid of, asking their partner for what they want, either being foreplay or certain positions, or, they're just embarrassed. They think, again, is sex dirty? Should I not have so much pleasure? Is it okay that I know this? Is it okay that I read 50 Shades of Grey and now I want to do something that I read about in the bedroom with my partner? But what if my partner there's just all this, how about just start talking and open that conversation? And, so for example, the use of vibrators. So some women want to be able to have an orgasm during penetrative sex, and they can't just with that. So what about using a vibrator with that? And so many women say, well, I don't want to bring that up to my partner. What if he feels inadequate, or she feels inadequate? What if my partner feels that is not a welcome? And so I talk about a study that I read once that when partners are surveyed around the use of vibrators, they say, yeah, that would be pretty fun. That would be cool. I'd like to experiment with that when they're asked away from their other partner. So again, it's just starting that conversation and being open to what happens from there. I have some patients who may feel trapped in a relationship. Either, there's mismatched levels of desire. Maybe the relationship's not healthy, and they're in a relationship for other reasons than simply wanting to be in that relationship for, again, the very simple reasons. So there's there's different levels of desire, either frequency or types of sexual activities that happen, or just wanting different things in terms of when sex happens, where sex happens. And so again, it's I talked to a patient recently, I really encourage you to own your voice, to say what you need, to say what you want, and to own that. It's your body. You have boundaries. You have rules for yourself, what you're okay with, what you're not okay with. And again, it's so important to own that. And the other thing is just women suffer because they might feel alone. Physical pain, I went out of order. So physical pain with outer course or penetration. And we're going to talk more about that in just a second in terms of one option. I'm going to really focus today on the Mona Lisa laser to talk about treatment for pain with outer course or penetration. So pain with sex is just a really difficult thing to suffer. But again, it doesn't need to be suffered. There are so many options to treat or to help women feel better. I will joke with my patients, there's never been a bottom I can't fix in terms of if there's an issue that we see. And so if there's pain, of course, some women will try to suffer through. They'll just try to gut it out. I mean, that's not what sex is for, right? It is for intimacy and pleasure. And if there's pain, there's certainly not room in the brain for pain and pleasure at the same time. So if you have sex, or if you have pain with sex, either outer course or intercourse or penetration, please ask for help. And we at True are very comfortable, obviously, talking about this. I'm also an active member of ISHWISH, the International Society for the Study of Women's Sexual Health. We're working on right now building a website with much more information about all aspects of sexual health, starting with pain with sex. But also, if you even go to the menopause website, the menopause.org, then you can find providers who are comfortable talking often at least about menopause and the changes that happen with menopause, if not also pain with sex. So you'll see the link in the comment section. And then, another thing is difficulty with positions due to back or hip pain, or even being overweight can make certain positions difficult. It doesn't mean that there can't be pleasure and intimacy and comfort, but it's just to talk through this. If your partner likes a certain position, but it hurts your hips, it hurts your back, let's talk about this. There's many other options for having pleasure with sex without just the basic, let's say, missionary or whatever it is. So there's lots of options. And Helen Coy, thank you so much for joining. I miss talking to you, and I appreciate your shout out for Mona Lisa. And we'll talk about that in greater detail here in a little bit. The last thing I want to talk about that too many women suffer from is just feeling alone. Too many women feel alone and they don't know what can be done to help. And again, I think the more that we have this conversation going and we're able to talk about these things openly, I think even 8 years ago as an OBGYN doctor, I was not comfortable saying the word orgasm. And then I said it on local TV and didn't get fired. So I got a little more comfortable with the term. So again, the more we say these things, the more we talk about these things, it just really does help everyone all around. And again, having confidence can certainly propel you forward. It can help you with growth in your personal self or in your relationship. But again, that lack of confidence can really hold us back from enjoying all that is possible. So again, here at True, we want to talk about what is normal for aging and how we can enhance your intimacy. And one of the most common problems that I talk to women about, again, is pain with sex. Again, it can be pain with outer course, any stimulation or foreplay that's done on the outside of the actual vagina, and then there is pain with intercourse. And we talk about pain with intercourse as being potentially caused by skin conditions on the outside, such as lichen sclerosis. We talk about pain from the skin on the inside, such as vaginal dryness. We call it genital urinary syndrome of menopause, meaning the tissue can become thin, it can tear, it can bleed from very low estrogen that happens in the perimenopause and mostly in the menopause. And this can happen in natural menopause. It happens around 52. It happens with surgical menopause. Let's say a patient recently with endometriosis who had both of her ovaries removed at 38. So she has surgical menopause starting at a very young age. And if that goes untreated, she would probably have significant pain with sex within a year or two of sudden surgical menopause. We also see women who suffer GSM or vaginal dryness related to, let's say, chemotherapy after breast cancer or radiation therapy and chemotherapy after anal cancer. So again, this is a very common condition. And we know that over a woman's lifetime, or I should say a group of women, 80% of women will suffer from pain with intercourse over their lifetime. So again, there are many safe options to consider. And we've had other conversations on Facebook Live talking about options such as vaginal estrogen, such as for mild symptoms, use of lubricants and vaginal moisturizers. We've talked about Interosa, which is a FDA-approved DHEA product. And we've also talked about topical testosterone in the vestibule or in that little area from 4 to 8 o'clock at the opening of the vagina. So sometimes that can be also helpful. But tonight, I really want to narrow in on the Mona Lisa laser. So it's called the Mona Lisa Touch. It is a CO2 fractional laser that is non-hormonal and chemical free. And just today at True, Suzanne Pettigrew, who's our PA, we were talking, it just kills us that we have this very expensive piece of equipment that is sitting empty. It's not being used as much as it could. So we have patients coming in for treatments. They're very satisfied, but it just kills us that women are out there suffering and we have this lovely machine that we chose to purchase, to have it True and to use. And so yes, there's the business case that we want to make sure and we pay off the machine. But again, we want this to be in the hands of people. And again, I was at first on the fence of buying this. But again, oh, sorry, my cat is walking by. Sorry, that's just Poseidon. So, but it's one of those things that again, I was on the fence with buying it because I wanted to make sure that it worked. And so I'll talk about this in a little bit. But as Helen Coy would say, it helped her But also we have really good research talking about the CO2 laser. So what is the CO2 laser? Its laser is light energy that's focused and directed to tissue. This is FDA cleared for use on soft tissue. So this is something that you might see your dermatologist or plastic surgeon use for aesthetics, used to treat, let's say, facial wrinkles or hair growth on the face. This is something that's used by, let's say, podiatrists for removal of warts. We use this in gynecology. It's cleared for use in the vagina and on the vulva and been proven to be safe and, again, effective. So this is laser energy that's focused on the tissue. The Mona Lisa is proprietary in the sense that it has a pulsing stack, so it's able to drive the energy safely a little deeper into the tissue. And when tissue is really thin, we use the smaller stack, and as the tissue gets more treated, we can use the deeper stack. Also, this is a proprietary pattern of laser energy that allows for quick healing, because there's essentially laser damage to the tissue that allows then the tissue to regenerate and to build strong. It creates a healing response, but there's little columns of natural tissue or unlasered tissue in between that helps promote healing. And so this is just such an important treatment that we use. And again, we use this in women who have skin changes related to low estrogen from natural or surgical menopause. It's very important to realize that the Mona Lisa is not to be used for laxity or prolapse, or I had a patient who presented who wanted it, for her tissue to feel tighter, for her tissue to feel like before vaginal delivery of babies. And I turned her away. This Mona Lisa touch is not for laxity. It's also not for stress incontinence. It's not for women who leak urine when they sneeze or cough, although I've had women say it really does help with their bladder urgency. It can help them feel like they've got more time to get to the bathroom when they have to empty their bladders. But we don't have as much data to support that it's helpful for bladder conditions. But as you see the comments in the side with Laura and Helen, it can be a game changer for pain. And when we use this procedure, I'm just going to scroll down to my list here. It's really important we follow the studies. So again, I'm going to show you, one of the original studies was the efficacy of the laser. We have these studies actually laminated in the office because we want people to see that there is good data supporting the effectiveness of this treatment. And so we know it's effective, we know it's safe. And in these studies that have looked at the efficacy of the Mona Lisa, is they measure certain things. And here at True, we follow that same protocol. So, what happens when a patient comes in is, again, we talk about what is her chief complaint, what is hard for her. So it might be pain, it might be itching, it might be just even a sense of dryness. It might be pain with outer course or pain on the outside, even just related to, let's say, dryness or to lichen sclerosis. And so when a patient comes in after we've done a thorough exam, we want to make sure that the pain from intercourse is not caused by other conditions that wouldn't be treated by the Mona Lisa laser. And so after we do a thorough exam and we plan to do the procedure, at the time of procedure, what we do is actually, number one, check a pH of the vagina. So we know that women who have low estrogen have a higher pH, which then can increase the risk of vaginal infections or overgrowth of bacteria that don't belong there. And so one of the measurements of the effectiveness of the laser is to see that pH come down from like 6.5 to 7 down to like 4.5, 5. And so we check the pH initially. We also use a vaginal dilator to measure the opening of the vagina. And in many of our patients, they start with just a 2.5 or a 3 and may go up to a 4 or 5. And we see that change even after one treatment. So again, I love having objective measurements. I don't want to sell something or recommend something that I don't think is going to work, especially when this is something that yet insurance does not cover. So again, it's having good data and proof that this is effective. Also, what we do is we check, we ask patient her symptoms, and we use a scoring system of 0 to 10. And we ask about pain with intercourse. We ask about just vaginal pain or discomfort. We ask about a sense of dryness and itching. We ask about bladder symptoms. And every time that a patient comes in, we ask those same questions, and we're able to see her progress over time. I see Helen Coy is saying it's very popular in Australia. So thank you, Helen, for that. We need to get it more popular in the US because, again, just too many women are suffering. Again, I'm looking at my list. Again, we talk about the number of treatments. So what's recommended? This Mona Lisa was developed in Italy, and it first started being used in 2012. It was brought to the United States, and it's in now over 60 countries. And the number of recommended treatments is 3 in the first year. So we do 3 treatments separated by 4 to 6 weeks in the first year. And then we do a treatment every 12 months following the timing of the first treatment. So let's say the treatment was in January, we'll do then the 4th treatment in January of the next year. And I can definitely tell that, and patients can tell maybe it's starting to wear off a bit. And maybe, I can even see by looking that the tissue looks a little bit, let's say, more dry or less pink and shiny, as we always say. And so we can just see that the tissue is starting to be, to lose the effect. And again, it's like getting our grays touched up. It's just, we have to talk about maintenance. If there's no longer estrogen in the system, either vaginal or in the system, then again, we just have to do that touch up. And it's been found to be very effective to do that at that frequency. We do want to offer a link to a patient testimonial. Joy was very generous to share her story in our office. And if you want to go on and watch her testimonial, she and I had a conversation on a Facebook Live about Mona Lisa. And Joy was, again, very willing to share her experience as a breast cancer survivor. She wasn't comfortable using vaginal estrogen, and which can be safe in many women who have had breast cancer. She wasn't comfortable using it, and she just kind of didn't want to deal with using a vaginal treatment. And so she chose to have the Mona Lisa and was very satisfied with the results. And again, we've had stories of patients over and over that have had these same results. Also, just to share, Suzanne Pettigrew is our PA at True. She has done some conversations on Facebook about her experience with the Mona Lisa as well, in terms of her treating patients with vaginal dryness, for example, especially in her area of specialty of cancer survivorship. So Suzanne is a PA who has done primary care for over 30 years. And also she had started several cancer survivorship programs and ran a high-risk breast clinic in a large health system for a while. And now she is at True. And so she has a lot of experience in taking care of patients who have had cancer, breast cancer, anal cancer, uterine, cervical. And so she's very comfortable in survivorship and issues that face women who have survived cancer. And again, the Mona Lisa is such a fantastic tool to use for patients who just don't want to use vaginal estrogen, don't want to deal with it, or they can't because they had an estrogen-dependent cancer. And so Suzanne is also trained in the Mona Lisa. We're both certified and able to provide that procedure. For patients of True, we offer a consultation free of charge around the Mona Lisa. If you're not a patient of True and you wish to come in for a consult, and then you wish, we do charge you for that, but then we'll apply that to the cost of the Mona Lisa if you choose to move forward with that. We have a landing page at True just talking about the Mona Lisa and talking about what happens if you choose to have that procedure at True. And so we've included that in the comments as well for those of you who are interested. So again, I look forward to you meeting Suzanne and seeing how we can offer you this treatment. Even we have openings even next week. So, would love to see and meet you for this. If there's any other questions, please just put them in the comment section as we're going along. If you have friends or family that would be interested in this topic, please share this with them. And again, if people want to talk about this, they can come into True and have a consultation, and we can walk through the whole process very thoroughly. When I do these Let's Chats, I always like to leave you with 5 takeaway tips. And today, those 5 takeaway tips, number 1 is that sexual health is so important for wellness. It's not just about the act. It's not just about an orgasm. It's not just about, again, that act. It's about health and wellness. I have so many patients who, let's say, go through menopause and they have vaginal dryness, they have pain with sex, they start to lose connection with their partner. It makes them, they talk about feeling old, feeling dried up, feeling done, feeling over the hill, all those different words that applies to how they feel, because sex isn't easy. Sex isn't something that just can happen with spontaneity. And so as they regain their confidence with their sexual health, let's say after having the Mona Lisa, it can really be a part of good health. It can be a part of feeling reconnected with your sexual partner, as well as just having pleasure. I have a patient who was a breast cancer survivor. She had the Mona Lisa, and she said it allowed her to reconnect with her husband. They could have outer course, they could still hug and snuggle and all that good stuff. But she said, I so missed penetration. I missed feeling close to my husband in that way. And breast cancer was so hard for her in taking away her hair, taking away a whole year of her life in terms of treatment and going through all of that. But she said one of the worst things about recovery was that, she could deal with most things. She really had a difficult time dealing with the fact that they couldn't have penetrative sex. So again, sexual health is so important for general wellness, not just the act. Tip number 2, Mona Lisa touch, or the Mona Lisa laser therapy, is a safe option for most common causes of pain. And again, that would be vaginal dryness from low estrogen. We also know in several studies it's been effective for lichen sclerosis. Now, I've not seen it where women can maybe totally stop their steroid treatment for lichen sclerosis, which unfortunately is quite common, this condition, lichen sclerosis. But I've definitely seen it help alleviate symptoms and maybe reduce how much steroid ointment a patient has to use. So again, this is a very safe option for those most common causes of pain. Tip number 3, pain with sex is very difficult to discuss in a relationship. And often there's a blame game, or there's fear of bringing it up. And it's such a root cause of making it difficult to talk about. And one thing that I invented to help people talk about sex is the sex deck. So the sex deck is a card game that I invented because, number one, I didn't know how to talk about sexual health with my patients, because it can be this cloudy, nebulous subject that is something that, where do you start? And how can I talk about this in an efficient way? So there's 27 reasons for low sex drive. And so they're all listed here. As I was developing the sex deck, I made sure and show it to 6 or 7 of my national colleagues who are experts in sexual health. And they really thought this would be helpful for patients to use, and for them to use in their offices in talking to patients about sexual health. On the back of each card is why the problem happened and what to do about it. And so this has been really helpful for our patients too, to take home and use to talk about sexual health with their partners. Yes, Melissa, and your friends. I might embarrass my friends with this sometimes, but thank you. It's very, very fun to get this going, to talk about this. But for example, one of the issues with low sex drive is incontinence. And so on the back of the card is why does someone have incontinence, and then what to do about it. Pain with sex is one of these cards. And so again, if you can take these home, a lot of times your partner is like, oh, this isn't your fault. This isn't my fault. This is just something that can happen. And if we can address it, there are things that we can do about it, then we can maybe get on with our sexual life like we used to have back in the day. And what's really fun is this is really help people get back to that conversation. Again, not have difficulty with a conversation. And many patients have told me it gave them hope. It gave them hope that it wasn't in their head, they didn't cause it, and there are things that can be done about it. So I definitely recommend you get the sex deck. It's available on our website. If you come in and you're a patient of True, we've got lots of them to share. And again, we hope that this sex deck spreads so all people can use it, and everyone can have good sexual health and more feminine confidence. Okay, so the next tip is tip number 4. The trick to discussing this is having confidence and ownership and boundaries. I had a patient who was in a relationship that they were both tired. There's both kids, there's just lots going on, and they were fighting about sex, and he would want to have sex when she didn't, and she felt almost obligated. And then it just became, she resented it, and they started fighting more about that. And I said, whose body is this? It's your body. Take ownership. Say, I don't want to have sex because we're fighting. I don't like how you're treating me about this. No, we're not having sex until we resolve this. So it's not withholding sex. It's not being manipulative. It's having boundaries. And it's saying, we have to address this. And if we can't address it together, let's go to a therapist. Let's talk about this with someone who knows more about this that can help guide us through this. It's a person's right to not have to experience pain in an act that should be full of pleasure. So I know I'm reading what I just wrote here, but it's just, I want to focus on this. This act should be full of pleasure and lightness and fun. It shouldn't be heavy. It shouldn't be, it's free, right? It should be something that can be enjoyed without stress or pain. So I could be on that soapbox for a long time. So let's move to tip number 5. Tip number 5 is using I statements can be very powerful. When someone says, I have pain, I want to have sex with you, but I can't because it hurts. I want us to talk about this. Then it can get away from the blame game. And once the conversation is started, I have so many patients who say, I started the conversation, I used I statements, I talked about what I want, and there was like, we were both just relieved that, oh, thank God someone started the conversation. I have patients who say, even when we're in a good place, I don't want to bring this up because then we're going to get in a fight and ruin a good moment. Oh my gosh, people, this should be the easiest thing you do. And once you get through the difficult conversation and just get things started, it can be a very bonding experience to talk about, what do you want? What do you not want? How do you want our sex life to be as we hopefully grow old together and we experience all these changes of aging? For example, some men aren't comfortable. They lose their sex drive because they're afraid they won't have an erection. So, boy, if I don't have an erection, I'm not a man anymore. I'm old. So therefore I don't even want to go there. And so then it becomes this vicious cycle of, again, more blame game, more feeling bad, all sorts of stuff that doesn't need to happen. So again, I could get on that soapbox for a while, but let's move on. So the next thing that I always like to talk about at Let's Chat is 5 questions that you can ask your healthcare provider. If you're not able to be at True or talk to one of us about these questions, I want these to be questions that you can ask your healthcare provider and make sure that you are informed and getting the care that you deserve. Again, at ishwish.org, you can see providers that are certified in sexual health or are members of the Ishwish Society. And also at menopause.org, you can find providers that are more comfortable maybe than the average OBGYN, or primary care provider. So the 5 questions that I want you to ask is, number 1, what is my phase of ovarian function? I know I talk about this every time, but it's so important, for you to know, am I in reproductive phase? Am I in perimenopause? Am I in menopause? Now, if you have an IUD, you might not have periods. If you've had a hysterectomy, you won't have periods. And so it can be really important to understand, where am I, to know, wow, is low estrogen causing my pain? It can really give us a lot of information about your libido or sex drive, about your pain with sex. So it's so important to know phase of ovarian function. And if the provider gives you a blank look, ask for a referral. Ask to talk to someone who knows about the phases of ovarian function and the phases of aging. It's critical to know this aspect. So question number 2, I want you to be able to ask, why do I have pain? And again, 10 years ago, 15 years ago, when I was doing very busy general OBGYN care, if you had asked me this question, I would have been like, I don't know, because I wasn't trained. I didn't know. I didn't know. So, I'd kind of heard some stuff, maybe read a little bit about it, but the training at the Menopause Society, at Ishwish, all the reading now I've done, all that I know in terms of how much we as a group of providers know about pain with sex, it's been just critical in my ability to take care of patients. So if your provider doesn't know why you have pain with sex, find a provider who does. Ask for a referral to someone, again, who is menopause certified, who is a member of Ishwish, who has been trained in sexual health. So critical to you deserve to have answers. So number 3, I want you to be able to ask, do I have to be stuck with pain? So is this pain treatable? So again, number one, it's why do I have pain and what are my treatment options? So I would argue, no, you don't have to be stuck with pain. Sometimes there are issues that are a challenge. I have patients who have had, let's say, radiation for anal cancer. They were not treated early with vaginal dilators. Their vagina is really short. And so maybe, no, they're not going to be able to have deep penetration without discomfort. But then we have things like the O-net, which is something that can be used to protect from deep penetrative pain. So again, there's things we can do even if there are conditions we can't change. And we can help, again, bring back the pleasure and the intimacy without pain. So important. Number 4, again, what are my options for treatment and who can help me? So it's so important to find providers that know what they're doing, because again, I really do feel that us providers, we should stay in our lane. So I wouldn't want you asking me about the best medicine for hypertension. That's why I hired Dr. Egan to be at True. So I know my lane, and it's so important that me as a healthcare provider that I tell you when I don't know something. It doesn't mean I'm less of a doctor. It doesn't mean I'm not as smart. It means that I know what I know well, and I'm going to take care of you. But if I don't know the answer, I'm going to help find you someone who does. And again, I think that all of us healthcare providers should have this attitude. And again, all of you deserve this. Okay, question number 5. Do you know what who the closest provider is? So there is definitely a link on the website to the Mona Lisa that you can find your provider. Even just Googling Mona Lisa, if you Google us, we'll come up, certainly in West Michigan, that we provide the Mona Lisa touch. And so it's really important to know who the closest provider is and where you can get this service. And again, you could always contact us at True, and we know those providers who have the Mona Lisa touch, and we can, help determine if this is the right thing for you. So please feel free to call our number to, first of all, go to our website, check out the link, and look at that landing page all about the Mona Lisa touch. Give us a call at the office and schedule a consultation. We've had patients who have downloaded our gift certificates that we have on our office, and they've sent them to their partners to say that's what they want for Christmas or the holidays. And so it can be kind of, again, a light thing to say, hey, I do want to have intercourse. I do want to have sex without pain. And this is something that you could do for me, do for us. And so, again, we've had people already download the gift certificate and send it off to their partners, and hopefully they'll fill it out and send it back. So again, I hope that this has answered some questions for you about the Mona Lisa laser. I hope that this has been a helpful conversation to just, if nothing else, get the conversation going. So I wish all of you a healthy and good evening. We hope to see you soon at True Women's Health. Be safe. Please stay healthy.